Hi, my name's Sandra. I'm a level 1 nursing student. I was wondering if you could give me a SPAR report on your patient, please.
Yes. I have room 231. Her name's Sinead O'Connor. She's a 34-year-old female. She's allergic to trimethoprim sulfamethoxazole. She's a full code. Her doctor is Dr. E. Engelbert. The doctor wants urine and blood cultures, IV antibiotic therapy, and she has dialysis today. She's diagnosed with a fever and end-stage renal disease. She presented today in the ER with fever, chills, and general malaise. She reports increased blood sugar and decreased appetite for the past few days with minimal urine output. She has a history of type 1 diabetes and renal failure due to diabetes. She undergoes dialysis 3 times a week. She's alert and orient ×4. She has deep tendon reflexes intact, sensation diminished in lower legs, and her pupils are equal round, reactive to light and accommodation. Her chest expansion is symmetric, lungs are clear in all 4 quadrants. She's on room air. She's tachycardic and regular rhythm. Her S1 and S2 is present, no murmurs or extra heart sounds. Slight 1+ non-pitting edema in lower extremities, 1+ pedal pulses, 2+ femoral. Cap refills less than 4 seconds. Her abdomen is soft, round, and non-tender. No visible masses, no organomegaly. Bowel sounds are present in all 4 quadrants. She voids herself and no bladder distension. Her last set of vitals are blood pressure 138/78, heart rate of 108. Respiratory rate of 20, 97% on room air. She has a left forearm AV graft with no tenderness, drainage, or recent color change. And she has an IV in her right forearm. Her urine was cloudy and amber. She had negative results for her urine. And she's going to get imipenem and cilastatin IV and sodium chloride. Okay.
Cool. I have some questions for you.
Okay.
Why specifically is the client receiving this medication, and what action does the medication have on the body?
The patient is receiving the antibiotic due to an infection. The imipenem possesses several traits that make it effective antibiotic, including a more efficient penetration through the bacteria's cell wall, resistance to bacterial enzymes, and affinity for all bacterial PBPs. Cilastatin inhibits imipenem from becoming toxic to the proximal tubule and kidneys.
When should you question administering this medication? Does it have a therapeutic serum level?
You should question administering the medication if the patient is allergic to imipenem, cilastatin, lidocaine, or other local anesthetics. It may decrease effectiveness of oral contraceptives. Therapeutic serum level of 21 to 58 micrograms a milliliter. And I would monitor all vital signs and monitor patient for seizures, signs and symptoms of anaphylaxis. And also I would monitor the CBC, LFTs, and serum creatinine and blood.
Thank you for covering the vital signs and physiological parameters.
I just knew what you were going to say.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and or at home?
I'd advise patient to report signs of superinfection like black furry overgrowth on the tongue, vaginal itching or discharge, loose or foul-smelling stools, and allergies. I would caution patient to notify doctor if diarrhea occurs, especially if it contains blood, pus, or mucus, and she should not treat the diarrhea without consulting the doctor.
Okay. What are the side effects and potential adverse reactions?
Seizures, dizziness, hypotension, diarrhea, nausea, vomiting, rash, itching, sweating, swelling at IV site, and allergic reaction.
How will you know the medication is effective?
When signs and symptoms of infection resolve and the lab values are back to normal.
Great, thank you.
So I'm going to pull out the medication. I have the sodium chloride, in a Permaxin IV, I'm gonna check them both against the MAR. So I'm gonna make sure it's for the right patient, the right date, the right time. I'm gonna check the patient's allergies. I'm gonna check the expiration date. Hello.
Hello.
I have your antibiotic.
Okay.
Do you know what you're giving this antibiotic for?
I believe so, yes.
Why?
Because I have an infection.
Do you know signs and symptoms to look out for?
Like anaphylaxis.
Yeah, and then you should watch out for seizures, dizziness, hypotension, diarrhea, a rash, itching, sweating, or if you have any problems with your IV site.
I'll keep that in mind. Thank you.
Can you tell me your name and date of birth?
My name is Shanae O'Connor.
And are you having any allergies?
I do. Here's my band. Trimethoprim solmethoxazole.
And how old are you?
34 years old.
We're gonna check your IV. Any burning or anything?
No. It tastes funny.
That's normal. I'm gonna prime the tubing.
Like, do the questions. And figure out that way I can be there when I have to, because I'm their patient too. You'll see it, if you're holding it like this, you'll see it.
What are you setting that at?
30 milliliters an hour.
Sensation is diminished, and she has numbness, and tingling only in her lower legs. She appears uncomfortable. Her
Hi, my name is Lisa. I'm a nursing student. My medical instructor assigned me to work with you today. Could you please give me an escort?
she has
Absolutely.
surgically
Alright, so we have Marty Yarn.
11 months
She's in room
ago.
529. She's 80 years old, female, Hispanic race, no known allergies.
Color change.
She was admitted Tuesday, 1500 for a non-healing sacral ulcer. Right now her diet is regular general. She's going to be NPO at midnight though because she has a surgical bereavement in the morning.
She doesn't have problem.
Right now she's in stable condition, but she had a stage 3 non-healing sacral ulcer for 3 months. And has been treated as an outpatient with no success. She has admitted from the physician's office. The patient has an IV in right dorsal metacarpal and no redness or swelling of the site was noted. Patient needs standby assist when getting up and ambulates with a walker. Right now she's on standard precautions. Her blood pressure is 144/90. Respirations are 24, temperature is 99.1, pulse is 88.
Good job.
Oxygen saturation is 92% in room air. And her pain was a 6 when it was last assessed, so we're going to need to assess that again when we go in there. She has a history of multiple admissions for dehydration and pneumonia. Last admission was 6 months ago. Patient does not smoke or has no history of heart disease or other chronic illness. Right now the patient is alert and oriented times 4. Cranial nerves 2 through 12 are intact. Motor and sensory examination of the upper extremities is normal. Reflexes are +1 symmetrically bilaterally. The chest expansion is symmetrical. Cleared auscultation in all fields except the interior and posterior has diminished breath sounds in the bases. The patient denies any chest pain, palpitations, and shortness of breath. She has a sinus rhythm with occasional premature beats. The patient complains of lower back pain. She's aching quality for the past 3 months. Her gait is coordinated but slow. She verbalizes a decreasing appetite, no complaints of nausea, vomiting, or changing stool patterns, consistency, or color. Patient complains of occasional stress incontinence with nocturia. Abdomen is soft, non-distended, non-tender, slightly obese, no masses. Bowel sounds are present in all 4 quadrants. Stool is brown, white, test is negative, and she has no rectal masses. She's frail, thinning skin is intact except for sacral wound, which is a stage 3 pressure ulcer. And the measurements are as follows: 4 centimeters by 4 centimeters by 1 centimeter. Involvement of surrounding tissue is kidney shaped. She has serous exudate without unusual odor. No undermining, tunneling, or bruising was noted, and she has poor skin pressure. So her lab diagnostics are as follows: urine is clear, amber in color.
Are you setting up the second channel?
Yeah, it's setting up the secondary.
Glycoside esterase, nitrates, ketones, and glucose. Phosphate is 3.0. Her blood culture and sensitivity came back as positive for E. coli, and that's why we're administering the gentamicin. Her albumin is 3.2, which is low. We're going to need to educate her on increasing her protein intake. BUN is 22, which is high. Potassium is 3.6. Sodium is 1.5. Hemoglobin is 12.1. Hematocrit 37, and white blood cell count is 12,500. The WBC differential, the lymphocytes are 4,500, which is high, and also her monocytes are high at 720. Her platelet count is currently 5,000. So right now the medications that she's on is gentamicin every 8 hours, also 1,000 milliliters of 0.9% sodium chloride with 20% milliliter 20 ml equivalent to KCl at 125 milliliters per hour. She's also on acetaminophen oxycodone every 4 hours for pain. Morphine sulfate injection, 2 milligrams IV every 2 hours for pain. She's also taking Senocide 8.6 milligrams, 1 to 2 tablets every morning, PRN. And she's also
your
on
call
Zolpidem, 5
Yes.
milligrams by mouth every night as needed for sleep. Some of the things I'm going to suggest for this patient is to take her vital signs every 4 hours. Her activity is up with a walker and standby assist. She's on a regular diet, but as I said before, she's on PO after midnight to secure a surgical decision in the morning.
I have a few more questions for you.
Warmth and swelling. Continue to monitor oxycodone.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I reviewed the 5 patient rates, the vitals, patient's allergies, lab values, IV patency, and checked for compatibility with the 2 medications.
Did this information affect your decision to administer the medication?
No, everything was normal and indicated I should administer the medication.
Did this information affect how you administer the medication?
No, the IV was patent. Patient wasn't allergic to the medication, and it was the correct patient rate.
Okay, that's all I have. Thank you.